Welcome to the Scientific Vigilance channel. In this video, we will explore the intricate realm of pharmacovigilance, delving into the nuances of medications, their concealed hazards, and their consequential events that have profoundly influenced this pivotal field. By the conclusion of this presentation, you will possess a comprehensive grasp of the significance of pharmacovigilance. Prepare for an enlightening exploration as we embark on this educational journey. Let's kick things off with the fundamental question: what in the world is pharmacovigilance? In simpler terms, pharmacovigilance is the scientific process of finding, understanding, and preventing any bad effects or issues caused by medicines or drugs. Now, you might be wondering, why should I care about pharmacovigilance? Pharmacovigilance is important because it keeps people safe when they use medications. Imagine taking a new medicine, it might have unexpected side effects or problems that we didn't know about during testing. Pharmacovigilance helps to find these issues early and prevent harm to people. It's like having a safety net for medicines, making sure do more good than harm. Let's travel back in time to explore one of the most chilling chapters in medication history, the thalidomide tragedy. Picture this: the 1950s, a seductive promise of better sleep and nausea reduction. Thalidomide, manufactured by the German company Chemie-Grünenthal, belonged to a class of drugs called sedative hypnotics. Tragically, it led to thousands of babies being born with severe birth defects such as limb deformities in developing fetuses, leaving a lasting scar on public health. Recent research has discovered that thalidomide disrupts a critical signal pathway in the body called BMP, DKK1B, and T signaling pathways. The BMP, also genetic proteins signaling pathway, is a complex pathway that involves the interaction of BMPs with specific type 1 and type 2 receptors. Each step of the BMP signaling pathway is controlled by various positive and negative modulators, allowing for signal integration with other signaling pathways. Thalidomide is a drug that is known to cause birth defects, and it has been found to upregulate BMP expression and DKK1 expression in the limb, which have important roles in limb development. Recent studies also shown that thalidomide also promotes the degradation of a transcription factor called SALL4 that is essential for limb development. Hold on to your seats because thalidomide wasn't alone in this dark tale. There are other shocking stories to uncover. Diethylstilbestrol or DES, prescribed to pregnant women in the mid 20th century to prevent miscarriages. Synthetic estrogen, classified as a non-steroidal estrogen, led to a significantly increased risk of reproductive and developmental issues in daughters who exposed to the drug. Some of the side effects include abnormally shaped uteri, infertility problems, or sometimes the drug can also cause premature births. And then there is Vioxx, rofecoxib, a powerful non-steroidal anti-inflammatory drug, NSAID, manufactured by Merck and Co. It was linked to an increased risk of heart attacks and strokes, causing its withdrawal from the market in 2004, leaving a painful impact on countless lives. The mechanism by which rofecoxib causes heart attacks and strokes is not fully understood, but it is believed to be related to its inhibition of the cyclooxygenase 2 enzyme. is COX-2 is an enzyme that is involved in the production of prostaglandins, which are important mediators of inflammation and pain. By inhibiting COX-2, rofecoxib not only reduces inflammation and pain, but it also reduces the production of prostacyclin, a kind of prostaglandin that helps to prevent blood clots and maintain the health of blood vessels. These stories aren't just isolated incidents, they have left their mark on the world. Pharmacovigilance is a global team effort. It's like a global puzzle with healthcare professionals, patients, and health regulators working together to ensure that the medications we trust are truly safe. Now, let's get into the nitty gritty of how this detective work unfolds. The first step is data collection, gathering various case reports, ICSRs about adverse events from every corner. Then the collected data is then analyzed to identify any potential safety signals or trends that may indicate a risk associated with the use of a medicinal product. Step 3 is a signal detection. It's a process of actively searching for and identifying safety signals from a wide variety of data sources. The main goal of signal detection is to identify either new risk with a product in a patient population or identifying a worrisome trend that may negatively impact patient safety. Step 4 is a risk assessment. Once a safety signal is detected, the next step is a risk assessment, which involves evaluating the potential risk associated with the use of a medicine and determining the benefit risk balance. So, here is the bottom line: pharmacovigilance is not just a scientific process, it's a story of dedication, a commitment to keeping us safe. And that concludes our comprehensive overview of pharmacovigilance. We hope you found this information valuable and insightful. Remember, staying vigilant in the world of science and medicine is key to ensuring the safety and well being of patients worldwide. If you found this presentation informative and engaging, please consider giving it a thumbs up and sharing it with your colleagues and peers. Your support helps us continue to bring you quality content on scientific vigilance. Thank you for joining us today, and until next time, stay vigilant, stay safe, and stay informed.